every dentist is going to get a situation where they do treatment, it's expensive, and it failed. This is a communication. Okay, it could be a technical issue. So if you're inexperienced or you're not trained properly, it could well be a technical issue, but mostly it's going to be a communication issue. One of the difficulties we have is that we don't want to tell a patient that they could have failures and all the things that could go wrong when we're inexperienced and when we're just trying to get the patient to agree to the treatment. So firstly, think carefully about why is it that you want the patient to do the treatment. Is it because you're excited about the treatment, or is it because it's the best thing for the patient? Whenever we do treatments because we personally are excited, and it's very hard to resist this, it's part of learning in dentistry, but whenever you do treatment because you want to do it, because you're excited, because you like the treatment, it's very, very much more likely that the patient will be unhappy. And it's just not worth it. It's not worth the grief for the patient and for you to go ahead with something that they're not willing to accept the risks for. Now, sometimes I get people say to me, well, if I tell the patient all of the risks, they might not go ahead. And I go, that's the whole point of informed consent. When you give people informed consent, it's not so that you can do whatever treatment you want to do and cover your bum legally. The point is that you tell them all the risks. If they don't want to continue with treatment, that is the point. That is why you're telling them. And it's better, I can tell you, to have someone not go ahead with treatment than to go ahead and wish they hadn't. That'll make them sad, and it'll definitely make you sad. Having said all that, when you deal with complex treatments in particular, tell the patient that it can fail and tell them what the costs are of failure. And if they're not willing to bear those costs, then don't do it. I mean, you can have a guarantee if you want to. I don't do a lot of guarantees. I do sometimes do treatment at no cost, redo it just because it seems like it could be my fault or it could be theirs, I'm not sure. But discuss the costs. So in my practice, if I am not going to guarantee an implant, then I go, okay, if your implant fails, this is how much it will cost for me to redo the procedure. It's not my fault if it fails. Well, often it's not, it's just random bad luck. Root canal therapy is a big one. Patients hate getting root canal therapies, and then it fails and they lose a tooth and then they have to get an implant. So discuss that with them. Go, look, the best treatment for you is root canal therapy, but a small percentage of them don't work. That goes for everything. It goes with, if you bake 100 cakes, not 100 will turn out. If you paint 100 cars, 100 won't turn out perfectly. Everything that you ever do in life, there's a small percentage that don't work out, and you either guarantee that or you discuss the cost of it. The reason I don't do a lot of guarantees personally is because then your high-risk patients, the ones who smoke and they drink and they eat pork crackle straight after the surgery and then they go boxing and skipping and whatever, those patients end up getting subsidised by the ones who do everything perfectly. So I find that patients get less complications if they know it will cost them money because they look after things better. If the patient is not willing to bear the cost of fixing it, then don't do the procedure. It's better for you to extract a tooth than to do root canal therapy and the patient is not willing for that loss of money if it goes wrong. And just tell them, if I do this root canal therapy and it doesn't work, you will lose your money and your tooth. Are you okay? Is that a risk you're willing to take? It doesn't happen very often, but it does happen to some people. So communication is the key to angry patients. Now, if they're so angry and you think that they're unreasonable, sometimes it's worth just swallowing your pride and giving them their money back, because life's too short to be fighting with people, okay? I mean, we can make a stand on principle, and sometimes we're perfectly in the right to not refund them, but nonetheless, sometimes it's easier to lose the battle and win the war. Sometimes it's better to give them some money back and not have an angry patient telling hundreds and hundreds of people that you're the worst thing that ever happened to them. And sometimes it's just worth it, because if I came to you and said, how much will you pay me to have no stress for the next 5 months? You might well pay thousands. And then you go, oh, I can't give money back. But it's the same thing. Sometimes it's just, even though you're perfectly right, the patient's wrong, they're unreasonable, sometimes we just give them the money back so that we don't have stress for months.